Hello, I'm Niteen Tapuria. I'm a surgeon with a special interest in treatment of hernias. I am based at the Nuffield Health Highgate Hospital where I do a lot of this surgery. You'd like to know what is a hernia? Well, a hernia is basically a defect in your muscle wall, and most commonly it's in the abdominal wall, as a result of which there is either fat or bowel which comes through the abdominal wall. Now, the hernia can be located in several parts of the abdominal wall. It could be in the belly button, it's called an umbilical hernia. It could be in any other part of the abdominal wall. And very commonly, it's in the groin, and that's called an inguinal hernia. There's another type of a groin hernia, which is a femoral hernia. That actually is a little more dangerous than the inguinal hernia because that has got a higher risk of strangulation. Why does the hernia happen? As I explained, it's usually a tear or defect in the muscle wall. Could be because of degeneration, could be age related, could be previous surgery, or could be trauma. So there are several risk factors, but sometimes we don't have an explanation. Do you need treatment? Well, you see, normally if a patient doesn't have symptoms, then I'd be happy to recommend a wait and watch approach, particularly for inguinal canal and umbilical hernias. The risk of strangulation is less than 1%. But you've got to be aware that if you have severe pain, or if you have a swelling which doesn't reduce, or your belly bloats up, you've got to go to the emergency and seek urgent attention. Now, obviously, even though wait and watch is safe, many people would like to opt and have an operation to fix it, even if they're very asymptomatic. And sometimes when people are in pain, then the recommendation is that we should do an operation to fix it. How do we fix it? Well, the standard operation is that we use a mesh. There are some people who offer mesh-free approaches, but not in my experience. I don't do that. I fix it with the mesh as gold standard. We could do it by the open method. We could do it by the keyhole. There is no one size which fits all. It's about seeing you in clinic and discussing with you and having an informed discussion and decision. Post-operative recovery, generally speaking, most people do well. Yes, there's a small risk of complications like bleeding, infection, or damage to structures around the hernia, but most people do well and go home the same day. You're expected to be able to walk, and the first few weeks you have to avoid high-impact exercises, and I generally say that you should avoid driving for the first 2 weeks, any heavy lifting for 8 weeks, and international travel for 4 weeks. So if you'd like to have your hernia fixed, I'm here in Nuffield Highgate, and I shall be happy to see you.